was on a Sunday morning when I was in the emergency unit on duty, but it was very quiet. But at 11:30, we got a call from a family that lives very close to the hospital. They sounded very agitated, and in the background you could hear that some of them were even crying. They said a few words, and that is, Michael LaRue is not waking up. At that point, I didn't even know who Michael LaRue was. But one thing for sure, Michael was in trouble. Hi, you are watching ED Files, and I am Dr. Thabo Mafa. What do we mean when we say a patient is unconscious? This is a state whereby they do not respond to an external stimulus. It could be a sternal rub, or it could be a verbal command, but this patient is just not responding. What are the possible causes for unconsciousness? You could have cardiac causes like a heart attack, what we call in medical terms myocardial infarction. You could have abnormal rhythms of the heart like ventricular fibrillation. On the respiratory causes or pulmonary causes, you could have a lung infection like pneumonia, or you could have a clot in the lung, what you call pulmonary embolism. On the gastrointestinal system, you could have a patient who has got severe diarrhea and vomiting with electrolyte losses and also low blood pressures. On the neurologic system, you could have a stroke. You could have an aneurysm in the brain that has burst. Or you could have brain injury. Also, you could have things like a space-occupying lesion or a tumor. On the metabolic causes, you could have severe metabolic acidosis or lactic acidosis, and also low sugar levels. Those are a few possible causes for loss of consciousness. Now, Michael LaRue is a 60-year-old male patient who is a known hypertensive and also a diabetic. Is also taking insulin. The previous evening on a Saturday, he spent a good time with his family. Michael LaRue, around about 9 o'clock, he took his medication and injected himself with insulin. But he never had a good meal. Around about 9 o'clock, he went to sleep, and the next morning, his wife tried to wake him up to go to church with them, but Mike did not wake up. She just assumed that probably he's tired from the previous evening as they spent a lot of time together as a family. They went to church, and around about 11 o'clock they came back, prepared breakfast for Michael. She tried to wake him up for the second time, but this time around, she noticed that Michael LaRue is unconscious. And at this point, we had to advise the family how to assess and manage Michael at this point in time. As you can imagine, a patient who is unconscious can be very tricky to manage for the healthcare professionals. Now, what more about a family that is not in the medical field? However, we took simple steps. We had to advise him to reassess his level of consciousness. They did the AVPU. And simply, that is, A is to check for alertness, and V to check for verbal response. P, check for response to a painful stimulus. U is when a patient is unconscious. In this case, Michael was unconscious. We also had to assess the ABC. That's your airway, that's your breathing, and that's circulation. On the airway, if a patient is unconscious, they have to check if there is any foreign object in the airway or in the mouth. And if there is, they need to take it out. But it shouldn't be done blindly. Otherwise, you can easily push it in deep into the throat. If there are any secretions or vomiters from the mouth, they have to turn him sideways so that there is good drainage from the airway. However, if we suspect that there could have been some element of head injury or neck injury, the head has to be stabilized. And also, cervical spine has to be stabilized so that we don't end up with spinal cord injury. The next thing is to check the breathing. Check if the patient is breathing, or if they are not breathing properly, like in a case of gasping respirations. And if that's the case, they have to give him what we call the rescue breathing. Pinch the nose, do a mouth-to-mouth resuscitation if you do not have a mouthpiece. On the circulation, they have to check the carotid pulse and even the radial pulse. If possible, they can also check a femoral pulse. In this case, Michael had a pulse. He was breathing, but he was unconscious. We advise him to call the paramedics to come and bring Michael straight to the hospital as soon as possible. The paramedics were there on time and brought them to an emergency unit. At that point, we had to reassess the ABCs which were already done, just to make sure that the airway is still maintained, to check if Michael is still breathing, and also to check if he still has a pulse. But now in a hospital setting, it becomes even more detailed. Because now, if you check in the airway, you have to decide if this airway is maintainable or not. You have to also decide if, you need to check for signs of lung infection. You have to listen to the chest, auscultate. Listen for signs of a lung collapse, chest infection. Reassess the level of consciousness also. If on your assessment, the Glasgow Coma Scale which is rated out of 15, is less than 8, you might have to intubate the patient. At this point, Michael's GCS, Glasgow Coma Scale, was way below 8. We had to intubate him, unfortunately. We assessed his blood pressures, heart rate, oxygen saturation. We put up a drip also. And in the process of putting up a drip, we drew some blood for tests. We did blood gas. We did full blood count. We checked for CRP, which is an inflammatory marker. We did UNE, which is a renal function test. We also did some bloods for the cardiac profile to check if he did not have a heart attack. We did ECGs also to check the rhythm of his heart. Like I said, you have to assess if Michael is not having signs of heart attack on an ECG, and also to check if his rhythm is a normal one on an ECG. Other tests were also done, or investigations were also done. We took him for a CT scan of the brain just to check if there is no brain damage or a bleed in the brain, or if there's no tumor in the brain. Fortunately, we did not find any of those. His pupils were equal and reacting to light. We took him for a chest X-ray to check if his lungs are in a good condition. He did not have any signs of pneumonia or any signs suggestive of a lung collapse. We had a look at all other bloods. He did not show any signs of infection on his full blood count. His white cell count was within normal limits. His hemoglobin did not show any signs of anemia, and also his platelet count was within normal limits. His kidney function was looking fine. The urea, the creatinine, and GFR were within normal limits, and all other electrolytes were looking okay. But in the process of investigating all those, we got a blood gas. We looked at his oxygen, carbon dioxide, bicarbonate, and base excess. Surprisingly, these were all in the normal limits. But one thing that we picked up, Michael had a very low sugar level of 0.8. It seems like this was the main cause for his low level of consciousness. We gave him dextrose, that's sugar in a drip, and observed him for a while. And in the process of doing that, we completed our examinations, we completed our investigations, and we found nothing. But we noted that Michael is starting to respond and starting to wake up. He was very responsive to a point whereby we even had to extubate him. So, in a nutshell, in a patient who is unconscious, we have to run all these investigations before concluding what the possible cause could be. We could not say this is hypoglycemia only and leave it at that. We had to complete our examination. We had to complete our investigations. And only after then we can conclude what the possible cause could be. Even from the test that we've done for pulmonary embolism, everything was clear, but we could not have left it out just because of the low sugar that we saw on the blood gas. So in conclusion, early recognition of the signs and symptoms, or if you notice that a patient is unconscious, they need to be treated as early as possible, and that could definitely save a patient's life. And thank you for watching.